Alright guys, welcome back to Nurse Catherine here. Welcome back to my channel. In today's video, I am teaching you some really helpful tricks that I have learned along the way of my nursing career for those patients who have just not great veins to poke. Placing IV sites can be one of the most challenging skills for a nurse. Some hospitals allow their RNs to place IVs. Some hospitals do not allow their RNs to place IVs. Some hospitals have IV teams. Other hospitals, the bedside nurse is doing everything. Or even in the outpatient setting, as I'm working in the outpatient setting now, I'm putting IV sites in still in the outpatient setting. So these skills and these tips that I'm teaching you today can be extremely helpful in preparing you to place IV sites and just helping you along your journey of already placing IV sites. I am going to make this video short and sweet, so let's get it started. So first, let's touch on supplies that you will need to be able to even place this IV site in this patient who has very hard veins to even find. You are going to want a towel and access to hot water, warm water, not scalding hot water, but warm water. Next, you will want a tourniquet. I only have one tourniquet. It's actually a makeshift tourniquet, but you will want 2 tourniquets, not just one tourniquet. You want 2 tourniquets. The trick to finding a hard vein is using as many methods as possible to get those veins showing. So the first thing that you are going to do is put the tourniquet on your patient. If you did not see my video on how to place a tourniquet on a patient, make sure to go check that out. I'll put it up in this link. So make sure you go check that video out because it will make your job so much easier and it doesn't hurt the patient when you're putting the tourniquet on. Okay, so you put your tourniquet on the patient. Let's say you're not seeing anything, the veins are flat, they're not juicy, they're non-stickable, as what I like to say. You then are going to double up the tourniquet. So now you are going to put 2 tourniquets on. Put them at the same spot. One slightly lower or higher than the other one, dependent upon where you are hopefully trying to stick this patient. Now that you have 2 tourniquets on your patient, you are going to grab your washcloth or your towel or your small heating pack that are made to help veins show. So grab your towel and place warm water on it. Make sure it is not hot water. You do not want to burn your patient. You are going to take your patient's arm and take the towel or the washcloth, depending upon where you're hopefully trying to find that vein, and put it over their entire arm. And you are going to allow your patient's arm to sit just like that, just for a few seconds if the tourniquets are already on. You can do this prior to putting the tourniquets on as well. So you can wrap their arm, let it sit for a couple minutes without the tourniquets on, and then take the towel off, put a tourniquet on or 2 tourniquets if need be, and you should have a vein hopefully pop right up. Now, if you don't have a vein pop right up, there is one specific spot I always like to look for when placing an IV site. So right along this area, you can find a good vein normally. But if you don't, what do you do next? You're going to try the other arm, of course. Go try these techniques on the other arm. Put the hot towel, not hot, but warm towel on the patient's arm for a couple minutes. Go back, place the tourniquet or 2 tourniquets if need be, and try to find a vein that way. And last tip, remember when you are palpating for veins, palpate softly. Do not press hard. You might be missing a vein if your pressure of your fingers are too hard on the patient's arm. Right here I have a great vein. Now if I press too hard on that vein, I can't feel it. But if I press softly, I can feel the sponginess of that vein. So how much pressure you're putting into your fingers on those veins can really make it tricky as well if you are unable to feel any vein. But those are my tips and tricks for you all for trying to find those hard to stick veins in your patients.